Hi, I'm Dr. Edwin Williams, and in this video, there's a lot of traction in social media and everywhere else on thread lift or PDO lift procedures. So I just want to get to the bottom of it. Again, someone with 32 years experience as a facial rejuvenation specialist, a facelift specialist, who back in the mid-2000s had done a number of thread lift procedures. I've published on 2 papers on thread lifts. So this is my professional opinion. I just want to get to the bottom of it so people understand what's going on with this trend, again, of thread lifts being popularized and promoted. There was a lot of confusion about barbed sutures or the thread lift. And to me, it really kind of blows my mind. So I'm here to basically tell you what I believe about barbed sutures. Now, they were brought onto the market under a different name, and I don't want to use trade names, but they were around 2006. And it never made sense to me. So the first thing I do as a surgeon is say, does this make sense to me? We know that by just pulling tissue tighter with material, if it isn't cut, released, and repositioned and then put in that place, by simply just putting something through and pulling it tighter, eventually that material pulls out. For example, in reconstructive surgery, when someone has a paralyzed facial nerve, we used to use these Gore-Tex slings. Now, Gore-Tex is a very bioinert material, and you can actually use that to thread it down and bring up the smile, but eventually that pulls out. So when the thread lifts or barbed sutures, which you put a number of them in to kind of try to get a lift up, when they were first put on the market, it never made sense to me. But I said, you know, I'm going to give this a try. And I had a number of patients who really wanted it. So I went through the training, I got the training. In and around 2008, we published an article. And what I found in that article was there was basically no difference at 1 year from patients who had just a thread lift procedure versus not. So, and to this day, and this is astounding to me, to this day, those permanent sutures that were used, they were pulled off the market. There's not one good study, side-by-side study, that showed that patients have a real, true 6-month result and a 1-year result. So they took them off the market 2009 or something like that because these permanent sutures didn't pan out. They were painful. Well, sure enough, they brought them back onto the market again around 2017 and 18. And it's astounding to me that doctors will do this procedure. In fact, in our very town here, now I'm a rhinoplasty surgeon. I've done thousands and thousands of rhinoplasties. They are putting barbed sutures and threads in one of the local spas in patients' noses. There was actually a blog by a patient who had one put in her nose, and they went back to the provider, and the doctor said, well, I can't really take them out. Now, I'm a surgeon, so I can take them out, and I can deal with those complications, and I don't put threads in the nose, so it's astounding to me that somebody else is doing that. So I can tell you I've looked at all the literature. I published an editorial again in 2017 saying there really is not good merit for using these. Now, here's the one thing that the companies say. We are FDA approved. What the FDA has approved them for is safety. But the reality is, when we're looking at a procedure for a patient, I want to know, is this going to provide value for the patient? Is it going to provide something long-term? And I go back to the same, there is not one good study that someone who's had a thread lift and spent thousands and thousands of dollars on those thread lifts has a long-term result. So that's my take, it's my opinion, it's my professional opinion on the barbed suture or thread lift, PDO suture, whether they're dissolvable or not. It makes no sense to me, and there's not one good study. So it makes it very hard for me to understand why people are offering them in their med spas. So if you're considering a PDO thread lift type procedure, what are the alternatives? Well, here's the thing is, it's very appealing to have a lesser procedure performed in the office without having to have anesthesia, without having to go to the operating room. I get that. That's very, very appealing. I've just told you I don't believe there's long-term value. So what are your options? Well, there are some of the minor skin tightening devices. Quite frankly, many of them have a borderline result as well. But again, if you're not getting a result at all with a thread lift, then why would you even consider it? But what are your alternatives? Really, the best alternative that someone is really considering, they're bothered by their jowls, their mid-face, their neck, most of those patients really either need need, I say need, would benefit from a true lower face and neck lift. There are some of the mini lifts that are effective. They at least give patients results there, and I would just make sure you go to a trained surgeon as an alternative to a thread lift procedure, because I think the reason they are brought on the market is there are a lot of non-core specialists that feel like they can at least offer something for their patients. I just don't think that the value is there, even though they may be safe. And if there's anything at all that you're considering along the lines of facial rejuvenation, the one thing you're going to get from us is honesty. So you're certainly welcome to consult with us. We do virtual consultations with patients. We do face-to-face consultations, and we put patients on a computerized imaging. And I'm not going to show somebody something in an image that I don't think we'd accomplish, because